Psychiatric Nursing. Section 1. Introduction to Psychiatric Nursing. 1. Which of the following is a type of mental and emotional problem? A. Depression. B. Anorexia. C. Pyromania. D. All of the above. The correct answer is D. All of the above. 2. How many aspects of the patient's health must be considered in order to provide effective care? A. 1, B. 2, C. 3, D. 4. The correct answer is B. 2. 3. Which of the following is an aspect of the patient's health that must be considered in order to provide effective care for the patient? A. Physiologic. B. Psychological. C. A and B. D. Nutritional. The correct answer is C. A and B. 4. Patients with psychiatric problems can be found in blank part of the hospital. A. Intensive care unit. B. Psychiatric unit. C. Emergency unit. D. All of the above. The correct answer is D. All of the above. 5. The following are examples of community mental health programs except A. Toastmasters programs. B. Victim assistance programs. C. Family advocacy programs. D. Domestic violence shelters. The correct answer is A. Toastmasters programs. 6. Which of the following have led to the increase in incidence of mental and emotional disorders? A. Lack of support systems. B. Financial challenges. C. Child abuse. D. All of the above. The correct answer is D. All of the above. 7. According to Han Selye, the general adaptation syndrome has blank stages: A2, B3, C4, D5. The correct answer is B3. 8. During the blank stage, any type of physical or mental trauma triggers immediate biological responses designed to counter stress. A. Resistance. B. Alarm reaction. C. Exhaustion. D. Introduction. The correct answer is B. Alarm reaction. 9. The blank stage occurs when the body starts to adapt to prolonged stress. A. Adaptation. B. Alarm reaction. C. Resistance. D. Exhaustion. The correct answer is C. Resistance. 10. Mental disorders occur within which of the following age groups? A. Below 20. B. Above 20. C. Above 60. D. Any age group. The correct answer is D. Any age group. 11. The rate of teenage depression has blank within the past 20 years. A. Decreased by 20%. B. Increased by 20%. C. More than tripled. D. Remained constant. The correct answer is C. More than tripled. 12. Among the elderly, the following have contributed to an increase in depression except A. Isolation. B. Loneliness. C. Sickness. D. Fear. The correct answer is C. Sickness. 13. A syndrome or pattern must be considered as a blank before it can be taken as a mental disorder except A. Behavioral dysfunction. B. Psychological dysfunction. C. Biological dysfunction. D. Nutritional dysfunction. The correct answer is D. Nutritional dysfunction. 14. The DSM-4TR, Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, uses a blank approach. A. Classical. B. Traditional. C. Multi-axial. D. Clinical. The correct answer is C. Multi-axial. 15. According to the approach stated by the DSM-4TR, Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, every patient must be evaluated on blank axes: A2, B3, C4, D5. The correct answer is D5. 16. The following are axes on which patients can be evaluated except A. Physical evaluation, B. Clinical disorders, C. Personality disorders and mental retardation, D. General medical conditions. The correct answer is A. Physical evaluation. 17. Personality disorders and mental retardation is evaluated in which axis? A. Axis 1, B. Axis 2, C. Axis 3, D. Axis 4. The correct answer is B. Axis 2. 18. Which of the following is an example of a patient's diagnosis on Axis 3? A. Recent remarriage. B. Death of father. C. Acute bleeding episodes. D. Adjustment disorders. The correct answer is C. Acute bleeding episodes. 19. Blank is known as the level of functioning reported as a number from 0 to 100 based on the patient's overall psychological, social, and occupational function. A. Psychological and social functioning assessment. B. Global assessment of functioning. C. Psychosocial and occupational assessment functioning. D. None of the above. The correct answer is B. Global assessment of functioning. 20. Life events or problems that may affect diagnosis, treatment, and prognosis of the mental disorder is evaluated under which axis? A. Clinical disorders. B. Personality disorders and mental retardation. C. Psychosocial and environmental problems. D. General medical conditions. The correct answer is C. Psychosocial and environmental problems. 21. Which of the following is an example of a patient's diagnosis on Axis 2? A. Obsessive-compulsive personality. B. Crohn's disease. C. Acute bleeding. D. Death of parent. The correct answer is A. Obsessive-compulsive personality. 22. All of the following are roles performed by nurses in helping troubled patients except A. Prescribe drugs. B. Administering prescribed drugs. C. Monitor drugs' effect. D. Act as primary therapist. The correct answer is A. Prescribe drugs. 23. Which of the following places can a psychiatric nurse practice? A. Psychiatric hospitals. B. Schools. C. Prison. D. All of the above. The correct answer is D. All of the above. 24. To care for patients, you need to develop a blank and orderly way of dealing with problems. A. Practical. B. Theoretical. C. Classical. D. Manual. The correct answer is A. Practical. 25. A psychiatric nurse can take up which of the following roles? A. Program evaluator. B. Researcher. C. Consultant. D. All of the above. The correct answer is D. All of the above. 26. Blank defines nursing practice and performance. A. Association practice standards. B. Professional practice standards. C. American professional practice. D. Professional association practice. The correct answer is B. Professional practice standards. 27. Collecting patients' health data is related to which of the following standards by ANA, American Nurses Association? A. Standard 1. B. Standard 2. C. Standard 3. D. Standard 4. The correct answer is A. Standard 1. 28. The nurse implements the interventions identified in the care plan relates to which standard according to the ANA, American Nurses Association? A. Standard 5A. B. Standard 5B. C. Standard 5. D. None of the above. The correct answer is C. Standard 5. 29. The Standard 2 of the American Nurses Association Standards of Care stipulates which of the following? A. The nurse collects patients' health data. B. The nurse analyzes assessment data. C. The nurse develops care plan. D. The nurse identifies issues wrong with patient. The correct answer is B. The nurse analyzes assessment data. 30. Nurses are expected to select interventions according to their blank. A. Practice level. B. Age level. C. Salary level. D. All of the above. The correct answer is A. Practice level. 31. According to standard blank, the nurse provides structures and maintains a therapeutic environment in collaboration with the patient and other health care providers. A. Standard 5A. B. Standard 5B. C. Standard 5C. D. Standard 5E. The correct answer is B. Standard 5B. 32. The basic level nurse may select which of the following interventions? A. Milieu therapy. B. Crisis intervention. C. Community-based care. D. All of the above. The correct answer is D. All of the above. 33. Which of the following must be performed only by the APRN-PMH, Advanced Practiced Registered Nurse in Psychiatric and Mental Health? A. Consultation. B. Counseling. C. Implementation. D. None of the above. The correct answer is A. Consultation. 34. Blank model holds that behavior is motivated by avoidance of anxiety and attainment of satisfaction. A. Psychoanalytic model. B. Interpersonal model. C. Social model. D. Medical model. The correct answer is B. Interpersonal model. 35. Blank model holds that disease is the cause of deviant behavior. A. Nursing model. B. Medical model. C. Psychoanalytic model. D. Communication model. The correct answer is B. Medical model. 36. The blank model emphasizes the person as a biopsychosocial being. A. Existential model. B. Nursing model. C. Medical model. D. Social model. The correct answer is B. Nursing model. 37. The blank model proposes that the entire sociocultural environment influences mental health. A. Environmental model. B. Social model. C. Socio-environmental model. D. Communication model. The correct answer is B. Social model. 38. According to the humanistic model, understanding human behavior requires familiarity with blank levels of need. A. 4, B. 5, C. 6, D. 7. The correct answer is C. 6. 39. Physiological survival is on level blank on the humanistic model Maslow hierarchy. A. Level 2. B. Level 3. C. Level 1. D. Level 4. The correct answer is C. Level 1. 40. Which model focuses on patients' actions? A. Communication model. B. Behavioral model. C. Social model. D. Nursing model. The correct answer is B. Behavioral model. 41. Based on blank model, nursing developed the concept that the nurse should work to restore the patient to a state of full life from a state of self-alienation. A. Existential model. B. Medical model. C. Behavioral model. D. None of the above. The correct answer is A. Existential model. 42. There are blank number of phases in the nurse-to-patient relationship. A6, B5, C4, D3. The correct answer is C4. 43. At the blank phase, the nurse assesses the patient for unresolved problems. A. Introduction phase. B. Preliminary phase. C. Pre-interaction phase. D. Scheduling phase. The correct answer is C. Pre-interaction phase. 44. During the blank phase, nurse reviews and summarizes patient's progress. A. Concluding phase. B. Termination phase. C. Ending phase. D. Working case. The correct answer is B. Termination phase. 45. Which of the following factors can influence verbal communication? A. Patient's past experience. B. Patient's cultural background. C. Patient's religious background. D. All of the above. The correct answer is D. All of the above. 46. Which of the following factors can prevent effective communication between the nurse and the patient? A. Environment. B. Native language. C. Sexual orientation. D. All of the above. The correct answer is D. All of the above. 47. Nonverbal communication can include which of the following? A. Silence. B. Writing. C. Speaking slowly. D. None of the above. The correct answer is A. Silence. 48. Therapeutic communication includes the following except A. Minimizing. B. Validating. C. Restating. D. Focusing. The correct answer is D. focusing. 49. Non-therapeutic communication blank. A. Encourages insight. B. Creates stumbling blocks. C. Supports problem solving. D. Reduces stress. The correct answer is B. Creates stumbling blocks. 50. Blank is the process of identifying a patient's psychosocial problems, strengths, and concerns. A. Psychiatric identification. B. Psychiatric assessment. C. Psychiatric intervention. D. None of the above. The correct answer is B. Psychiatric assessment. 51. A systematic psychiatric interview gathers broad information that helps you to A. Assess the patient's psychological functioning. B. Formulate the care plan. C. Identify the underlying or precipitating cause of his problem. D. All of the above. The correct answer is D. All of the above. 52. All of the following are guidelines that can be followed when conducting the patient interview except A. Ensuring privacy. B. Using reliable information sources. C. Making assumptions. D. Showing support and sensitivity. The correct answer is C. Making assumptions. 53. Assessing blank will help gain insight into the patient's environmental development. A. Psychiatric history. B. Psychosocial history. C. Family history. D. Medical history. The correct answer is C. Family history. 54. Assessing the patient's blank will help you evaluate mental and social status function. A. Family history. B. Medical history. C. Psychiatric history. D. None of the above. The correct answer is D. None of the above. 55. Reviewing patient's medical history helps the nurse to know which of the following details: patient's list of medications. B. Patient's religious practices. C. Patient's sleeping patterns. D. All of the above. The correct answer is A. Patient's list of medications. 56. The nurse must observe the patient's blank. A. Behavior. B. Gestures. C. Mannerism. D. All of the above. The correct answer is D. All of the above. 57. Which of the following is referred to as a pervasive feeling or state of mind? A. Activity level. B. Mood. C. Attitude. D. Behavior. The correct answer is B. Mood. 58. Which of the following is known as variation in affect? A. Feelings. B. Mood. C. Range of emotions. D. Affect. The correct answer is C. Range of emotions. 59. The following are indications of mood disorder except A. Flat affect. B. Lability affect. C. Situational affect. D. Inappropriate affect. The correct answer is C. Situational affect. 60. Blank is an unresponsive range of emotion which may signify Parkinson's diseases. A. Flat affect. B. Situational affect. C. Unresponsive affect. D. None of the above. The correct answer is A. Flat affect. 61. Blank is known as a rapid and dramatic fluctuation in the range of emotions. A. Dramatic affect. B. Lability affect. C. Fluctuating affect. D. Flat affect. The correct answer is B. Lability affect. 62. Asking a patient to repeat the same word after 5 to 10 minutes is known as A. Improved recall. B. Immediate recall. C. Delayed recall. D. Assessed recall. The correct answer is C. Delayed recall. 63. Blank is referred to as the interpretation of reality as well as the use of the senses. A. Insight. B. Judgment. C. Perception. D. Comprehension. The correct answer is C. Perception. 64. Proponents of the cognitive theory have proposed that depression arises from blank. A. Perceived loss. B. Distorted perceptions. C. Unresolved conflicts. D. All of the above. The correct answer is B. Distorted perceptions. 65. An experience where patients perceive non-existent external stimuli is known as blank. A. Hallucination. B. Illusion. C. Depression. D. None of the above. The correct answer is A. Hallucination. 66. An experience where patients misinterpret external stimuli is known as blank. A. Schizophrenia. B. Hallucination. C. Illusion. D. Acute organic mental syndrome. The correct answer is C. Illusion. 67. Which of the following is associated with hallucination? A. Illusion. B. Acute organic mental syndrome. C. Depression. D. Bipolar disorder. The correct answer is B. Acute organic mental syndrome. The following disorders indicates organic disorders except A. Tactile hallucinations. B. Olfactory hallucinations. C. Gustatory hallucinations. D. Auditory hallucinations. The correct answer is D. Auditory hallucinations. 69. Blank are false beliefs with no firm basis in reality. A. Delusions. B. Illusions. C. Mental syndrome. D. Hallucinations. The correct answer is A. Delusions. 70. Only a blank can declare a person incompetent. A. A licensed practitioner. B. A judge. C. A doctor. D. None of the above. The correct answer is B. A judge. 71. Blank is a behavior that operates on an unconscious level to protect the ego and reduce stress. A. Self-destructive behavior. B. Defense mechanism. C. Incompetent behavior. D. Compulsive behavior. The correct answer is B. Defense mechanism. 72. Which of the following is an example of self-destructive behaviors? A. Denial. B. Regression. C. Projection. D. Mutilate body parts. The correct answer is D. Mutilate body parts. 73. Repeating certain actions to ward off anxiety without weighing the possible consequences of those actions is known as blank. A. Rationalization. B. Denial. C. Acting out. D. Withdrawal. The correct answer is C. acting out. 74. Blank refers to the creation of unrealistic or improbable ways of escaping from daily pressures and responsibilities. A. Undoing. B. Sublimation. C. Fantasy. D. Reaction formation. The correct answer is C. Fantasy. 75. Which of the following is an indication of suicidal ideation? A. Withdrawal from others. B. Putting affairs in order. C. Saying farewell to family and friends. D. All of the above. The correct answer is D. All of the above. 76. All of the following are safety precautions to be taken if you believe the patient has a high risk for suicide, except A. Plan for observation of the patient. B. Clarify day staff and night staff. C. Keep the patient's suicidal thoughts confidential. D. Provide a safe environment. The correct answer is C. Keep the patient's suicidal thoughts confidential. 77. Which of the following is an example of a personality and projective test? A. Beck Depression Inventory. B. Draw a Person Test. C. Minnesota Multiphasic Personality Inventory. D. All of the above. The correct answer is D. All of the above. 78. Cognitive assessment scale measure which of the following? A. Orientation. B. Cocaine use. C. Neurologic function. D. None of the above. The correct answer is A. Orientation. 79. Beck Depression helps diagnose blank and determine its severity. A. Hallucination. B. Depression. C. Illusion. D. Compulsion. The correct answer is B. Depression. 80. Blank tests help assess personality traits and ego functions in adolescence. A. Minnesota Multiphasic Personality Inventory. B. Draw a Person Test. C. Thematic Test. D. Sentence Correction Test. The correct answer is A. Minnesota Multiphasic Personality Inventory. 81. In a blank test, the patient is shown a series of pictures depicting ambiguous situations and asked to tell a story describing each picture. A. Draw a Person Test. B. Minnesota Multiphasic Personality Inventory. C. Thematic Apperception Test. D. Pictorial Test. The correct answer is C. Thematic Apperception Test. 82. Effective planning must include all of the following except A. Focus on specific client need. B. Consider patient's strength and weakness. C. Include feasible intervention. D. Choose appropriate nursing diagnoses. The correct answer is D. Choose appropriate nursing diagnoses. 83. Goals set for each applicable nursing diagnosis must blank. A. Relate directly to the nursing diagnosis. B. Reflects the desires of the patient and his family. B. Be measurable and realistic. D. All of the above. The correct answer is D. All of the above. 84. Antipsychotics are example of which therapy used in the treatment of psychiatric patients? A. Psychotherapy. B. Behavior therapy. C. Drug therapy. D. Electroconvulsive therapy. The correct answer is C. Drug therapy. 85. All of the following are types of counseling except A. Drug therapy. B. Psychotherapy. C. Electroconvulsive therapy, D. Behavior therapy. The correct answer is A. Drug therapy. 86. The goal of blank therapy is to identify and change the patient's negative generalizations and expectations. A. Individual therapy. B. Family therapy. C. Cognitive therapy. D. Group therapy. The correct answer is C. Cognitive therapy. 87. Blank uses the patient's environment as a tool for overcoming disorders. A. Cognitive therapy. B. Environmental therapy. C. Social therapy. D. Milieu therapy. The correct answer is D. Milieu therapy. 88. Which of the following is not a type of psychotherapy? A. Crisis intervention. B. Positive conditioning. C. Group therapy. D. Family therapy. The correct answer is B. Positive conditioning. 89. Blank is also called flooding. A. Implosion therapy. B. Aversion therapy. C. Milieu therapy. D. All of the above. The correct answer is A. Implosion therapy. 90. Blank provides safe alternative to self-withdrawal after prolonged dependence on alcohol and drugs. A. Response prevention. B. Detoxification. C. Avoidance therapy. D. Desensitization. The correct answer is B. Detoxification. 91. The most controversial treatment in psychiatry is the blank. A. Milieu therapy. B. Assertiveness training. C. Electroconvulsive therapy. D. Thought switching. The correct answer is C. Electroconvulsive therapy. 92. During ECT, electroconvulsive therapy treatment, a tiny electric current is applied to the brain for blank seconds. A. 1 second or less. B. 2 seconds or less. C. 3 seconds or less. D. 4 seconds or less. The correct answer is A. 1 second or less. 93. A typical course of ECT, electroconvulsive therapy treatment, involves a total of blank to blank ECT treatments. A. 4 to 10. B. 5 to 11. C. 6 to 12. D. 7 to 13. The correct answer is C. 6 to 12. 94. Blank provides nursing care to patients in inpatient settings. A. Clinical specialist. B. Advanced practice nurse. C. Psychologist. D. Nurse generalist. The correct answer is D. Nurse generalist. 95. The Mental Health Systems Act specifies which of the following? A. Treatment must be given by an adequate staff. B. Treatment must be given in the least restrictive settings. C. Treatment must be given according to individual treatment plan. D. All of the above. The correct answer is D. All of the above. 96. Obtaining informed consent is the responsibility of the blank. A. Family. B. Patient. C. Admitting provider. D. Court. The correct answer is C. Admitting provider. 97. The blank states that the patient has the right to expect that all communications and records pertaining to his care are kept confidential. A. ANA Code of Ethics. B. American Hospital Association's Patient Bill of Rights. C. Mental Health System Act. D. Mental Health Patients Bill. The correct answer is B. American Hospital Association's Patient Bill of Rights. 98. The law requires disclosure of confidential information under which of the following circumstances? A. Suspected child abuse. B. Legal guardian requirement. C. Necessary academic requirement. D. All of the above. The correct answer is A. Suspected child abuse. 99. Mentally ill patients have right to which of the following? A. Marriage. B. Have children. C. Use contraception. D. All of the above. The correct answer is D. All of the above. 100. Restraining should not be used as A. Punishment. B. Staff convenience. C. Substitute for treatment. D. All of the above. The correct answer is D. All of the above. 1. Which of the following is an example of common psychiatric disorder affecting youths? A. Attention deficit hyperactivity disorder, ADHD. B. Mental retardation. C. Conduct disorder. D. All of the above. The correct answer is D. All of the above. 2. According to the National Institute of Mental Health, about blank in 10 children suffer mental illness. A1, B2, C3, D4. The correct answer is A1. 3. Psychiatric disorders occur in children and adolescents of blank backgrounds. A. Poor. B. Middle class. C. Rich. D. All. The correct answer is D. All. 4. Which of the following factors put a child at greater risk of psychiatric disorder? A. Low birth weight. B. Physical problems. C. Abuse and neglect. D. All of the above. The correct answer is D. All of the above. 5. Personality formation is influenced by which of the following factors? A. Financial. B. Genetic. C. Nutritional. D. None of the above. The correct answer is B. Genetic. 6. Which of the following is the first step taken when caring for a child or an adolescent with psychiatric disorder? A. Determine the seriousness of the case. B. Establish a rapport. C. Open a new file. D. All of the above. The correct answer is B. Establish a rapport. 7. Freud theorized that the human mind consisted of blank major entities. A3, B4, C5, D6. The correct answer is A3. 8. Freud theorized that the human mind consists of which of the following entities? A. Id. B. Ego. C. Superego. D. All of the above. The correct answer is D. All of the above. 9. Which of the entities of the human mind seeks instant gratification according to Freud? A. Ego. B. Id. C. Superego. D. Logic. The correct answer is B. Id. 10. Which of the following is the product of rewards and punishment bestowed on the individual? A. Superego. B. Psychosexual development. C. Id. D. Ego. The correct answer is A. Superego. 11. According to Freud, there are blank psychosexual development stage. A3, B4, C5, D6. The correct answer is C5. 12. According to Freud, at which stage does the child learn to postpone immediate gratification and to manipulate surroundings? A. Oral phase. B. Anal phase. C. Phallic phase. D. Adolescence stage. The correct answer is B. Anal phase. 13. According to Freud, the child becomes aware of gender and develops social skills at which age? A. Birth to 1. B. 1 to 3. C. 3 to 6. D. 12 and older. The correct answer is C. 3 to 6. 14. According to Freud, at what stage does intellectual curiosity increase in a child? A. Oral phase. B. Adolescent stage. C. Latency stage. D. Phallic stage. The correct answer is C. Latency stage. 15. Erikson theory explains blank psychosocial development stages. A4, B5, C6, D7. The correct answer is B5. 16. According to Erikson, the infant derives a sense of security from gratification of needs at what age? A. Birth to age 1. B. Ages 1 to 3. C. Ages 3 to 6. D. Ages 6 to 12. The correct answer is A. Birth to age 1. 17. Blank theory describes the successive stages of mental activity that occur during childhood. A. Erikson's theory. B. Freud's theory. C. Piaget's theory. D. All of the above. The correct answer is C. Piaget's theory. 18. Blank theory suggests that new experiences may provide opportunities to cope with deficits in earlier stages. A. Erikson's theory. B. Freud's theory. C. Piaget's theory. D. All of the above. The correct answer is A. Erikson's theory. 19. Piaget's cognitive theory of development explains blank number of stages. A3, B4, C5, D6. The correct answer is B4. 20. Which of the following is a characteristic of a mentally healthy young person? A. Trusts parents and appropriate health caregivers. B. Views the world as a safe place. C. Has useful and satisfying relationships. D. All of the above. The correct answer is D. All of the above. 21. All of the following are ways to enhance communication with a child except A. Keep verbal communication lengthy. B. Make expectations clear. C. Avoid arguments. D. Ask direct questions when seeking specific information. The correct answer is A. Keep verbal communication lengthy. 22. Most children with attention deficit hyperactive disorder, ADHD, are diagnosed by the age of blank. A, 2, B, 3, C, 4, D, 5. The correct answer is C, 4. 23. Which of the following is assessed when evaluating the mental status of a child or adolescent? A. Verbal or physical aggression. B. Frustration. C. Anxiety level. D. All of the above. The correct answer is D. All of the above. 24. Attention deficit hyperactive disorder, ADHD, affects roughly blank of school-aged children in the United States. A. 2 to 4%. B. 3 to 5%. C. 4 to 6%. D. 5 to 7%. The correct answer is B. 3 to 5%. 25. Research suggests that attention deficit hyperactive disorder, ADHD, is caused by blank. A. Genetic influences. B. Nutrition. C. Financial instability. D. All of the above. The correct answer is A. Genetic influences. 26. Signs and symptoms of attention deficit hyperactive disorder, ADHD, falls into blank categories: A2, B3, C4, D5. The correct answer is B3. 27. Which of the following is a category of attention deficit hyperactive disorder, ADHD, symptoms? A. Inattention. B. Impulsiveness. C. Hyperactivity. D. All of the above. The correct answer is D. All of the above. 28. Blank makes children with attention deficit hyperactive disorder, ADHD, to lose things and make careless mistakes. A. Inattention. B. Impulsiveness. C. Hyperactivity. D. Inactivity. The correct answer is A. Inattention. 29. All of the following are signs of attention deficit hyperactive disorder, ADHD, except A. Persistent sadness. B. Failure to finish tasks. C. Blurting out inappropriate remarks. D. Talking excessively. The correct answer is A. Persistent sadness. 30. The Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, groups a selection of symptoms of attention deficit hyperactive disorder, ADHD, into blank categories: A5, B4, C3, D2. The correct answer is D2. 31. To qualify for the diagnosis of attention deficit hyperactive disorder, ADHD, the person must have at least blank symptoms from any of the categories: A2, B3, C5, D6. The correct answer is D6. 32. To qualify for the diagnosis of attention deficit hyperactive disorder, ADHD, the symptoms must have persisted for at least blank months to a degree that's maladaptive and inconsistent with a person's developmental level: A4, B5, C6, D7. The correct answer is C6. 33. Which of the following is a symptom of inattention? A. Often seems not to listen when spoken to directly. B. Clinical significant impairment in academic functioning. C. Has difficulty awaiting his turn. D. All of the above. The correct answer is A. Often seems not to listen when spoken to directly. 34. All of the following are symptoms of hyperactivity except A. Often talks excessively. B. Often fidgets with his hands. C. Often fails to follow instruction. D. Often has problem playing quietly. The correct answer is C. Often fails to follow instruction. 35. Often losing things necessary for task or activities is an example of which symptom? A. Impulsiveness. B. Hyperactivity. C. Inattention. D. All of the above. The correct answer is C. Inattention. 36. The diagnosis of ADHD, attention deficit hyperactive disorder, hinges on which of the following specific features? A. Characteristic behavior must appear before 8 years. B. Behaviors must continue for at least 8 months. C. Behaviors must be more frequent or severe than in other children the same age. D. All of the above. The correct answer is C. Behaviors must be more frequent or severe than in other children the same age. 37. Which of the following is a major treatment component for attention deficit hyperactive disorder? A. Psychotherapy. B. Education. C. Pharmacology. D. All of the above. The correct answer is D. All of the above. 38. Which of the following can be used to ease impulsivity of a child with attention deficit hyperactive disorder? A. Give him opportunities to participate in activities with peers. B. Teach the parents that hunger, thirst, and fatigue may trigger hyperactivity. C. Teach him how to make choices. D. None of the above. The correct answer is A. Give him opportunities to participate in activities with peers. 39. Blank central nervous system stimulants have been used effectively to control symptoms of attention deficit hyperactive disorder, ADHD, in both children and adult. A. 2, B. 3, C. 4, D. 5. The correct answer is B. 3. 40. Which of the following stimulants have been used effectively to control symptoms of attention deficit hyperactive disorder? A. Dextroamphetamine. B. Ampakines. C. Eugeroics. D. Phenethylamines. The correct answer is A. Dextroamphetamine. 41. Uncooperative behavior in a child may signal A. Attention deficit hyperactive disorder. B. Opposition defiant disorder. C. Obsessive compulsive disorder. D. None of the above. The correct answer is B. Opposition defiant disorder. 42. Which of the following is a cause of opposition defiant disorder? A. Parental rejection. B. Unsupervised child rearing. C. Family conflict. D. All of the above. The correct answer is D. All of the above. 43. All of the following are symptoms of opposition defiant disorder except A. Restlessness. B. Persistent fighting. C. Stubbornness. D. Temper tantrums. The correct answer is A. Restlessness. 44. Which of the following nursing interventions may be appropriate for a child with opposition defiant disorder, ODD? A. Help him address negative feelings. B. Discuss strategies he can use to control negative situations. C. Teach him how to express anger appropriately. D. All of the above. The correct answer is D. All of the above. 45. Blank behavior is the hallmark of conduct disorder. A. Compulsive. B. Aggressive. C. Depressive. C. Obsessive. The correct answer is B. Aggressive. 46. A child with conduct disorder blank. A. Fights. B. Sleeps excessively. C. Eats excessively. D. None of the above. The correct answer is A. Fights. 47. Among children ages 9 to 7, the prevalence of conduct disorder is approximately blank. A. 1 to 4%, B. 2 to 5%, C. 3 to 6%, D. 4 to 7%. The correct answer is A. 1 to 4%. 48. Conduct disorder has an onset before the age blank. A. 16, B. 17, C. 18, D. 19. The correct answer is C. 18. 49. Children with conduct disorder before the age of blank are more likely to develop antisocial personality disorder as adults. A. 9, B. 10, C. 11, D. 12. The correct answer is B. 10. 50. A child with conduct disorder is at high risk for blank. A. Sexually transmitted disease. B. Rape. C. Injuries. D. All of the above. The correct answer is D. All of the above. 51. Studies on conduct disorder suggest that the disorder has blank component. A. Biological. B. Genetic. C. Psychosocial. D. All of the above. The correct answer is D. All of the above. 52. All of the following are social factors that may predispose a child to conduct disorder, except A. Early maternal rejection. B. Early institutionalization. C. Learning impairment. D. Family neglect. The correct answer is C. Learning impairment. 53. Which of the following are physical factors that increases the risk of conduct disorder? A. Under-arousal of the autonomic nervous system. B. Parental psychiatric illness. C. Substance abuse. D. All of the above. The correct answer is A. Under-arousal of the autonomic nervous system. 54. Which of the following is a sign of conduct disorder? A. Using drugs. B. Neurological impairment. C. Depression. D. Receptive language problem. The correct answer is A. Using drugs. 55. Studies show that children who behave aggressive at age blank continue to do so at ages 11 to 13. A. 2, B. 3, C. 4, D. 5. The correct answer is B. 3. 56. A person who is blank or older doesn't meet the criteria for antisocial personality disorder. A. 16, B. 17, C. 18, D. 19. The correct answer is C. 18. 57. Conduct disorder can be considered to be on which of the following stages? A. Mild. B. Moderate. C. Severe. D. All of the above. The correct answer is D. All of the above. 58. Conduct disorder is considered blank if the conduct problems and effect on others can cause considerable harm. A. Mild. B. Extreme. C. Severe. D. Medium. The correct answer is C. Severe. 59. Blank is a syndrome of persistently sad or irritable mood. A. Unipolar depression. B. Anger. C. Oppositional defiant disorder. D. Attention deficit hyperactivity disorder. The correct answer is A. Unipolar depression. 60. Children with depression are likely to blank. A. Abuse drugs. B. Feel rejected. C. Be irritable. D. All of the above. The correct answer is B. Feel rejected. 61. About half of depressed patients experience blank episode and recover completely. A1, B2, C3, D4. The correct answer is D4. 62. In children and adolescents, a major depressive episode lasts an average of blank to blank months. A. 6 to 8, B. 7 to 9, C. 8 to 10, D. 9 to 11. The correct answer is B. 7 to 9. 63. Suicide attempts peak during the blank years. A. Childhood. B. Adolescent. C. Mid-adolescent. D. Elderly. The correct answer is C. Mid-adolescent. 64. Among adolescents, suicide is the blank leading cause of death. A. First. B. Second. C. Third. D. Fourth. The correct answer is C. Third. 65. Current research suggests which of the following as one of the causes of depression? A. Genetics. B. Social causes. C. Biochemical causes. D. All of the above. The correct answer is D. All of the above. 66. Among depressed patients, researchers have found imbalances in which of the following neurotransmitters? A. Serotonin. B. Norepinephrine. C. Dopamine. D. All of the above. The correct answer is D. All of the above. 67. Childhood depression differs from adult depression in which of the following way? A. Psychotic features are less common in children and adolescents. B. Anxiety is more common in adults. C. Physical symptoms like pains are more common in adults. D. Psychotic features are more common in children. The correct answer is A. Psychotic features are less common in children and adolescents. 68. All of the following are reasons why depression may go unrecognized by the child's family, doctors, and teachers, except A. Children may have trouble describing their emotions. B. Signs may be mistaken for the normal mood swings. C. Children know how to identify and express their opinions. D. Symptoms of depression may be expressed in varying ways. The correct answer is C. Children know how to identify and express their opinions. 69. Which of the following tools may be useful in screening children and adolescents for major depression? A. Beck Depression Instrument for Children. B. Adults Depression Inventory. C. Beck Depression Inventory for Adolescent. D. Diagnostic Depression Inventory. The correct answer is C. Beck Depression Inventory for Adolescent. 70. Treatment for major depression may entail which of the following? A. Psychotherapy. B. Cognitive behavioral therapy. C. Medication. D. All of the above. The correct answer is D. All of the above. 71. In the treatment of major depression, blank therapy focuses on working through disturbed relationships that may have contributed to the depression. A. Pharmacotherapy. B. Psychotherapy. C. Medication. D. All of the above. The correct answer is B. Psychotherapy. 72. Which of the following treatments for depressed children is controversial? A. Interpersonal therapy. B. Pharmacotherapy. C. Cognitive therapy. D. Behavioral therapy. The correct answer is B. Pharmacotherapy. 73. Medication may be considered as a first-line treatment for children under which of the following circumstances? A. If the child can undergo behavioral therapy. B. If the child can undergo cognitive therapy. C. If the child has recurrent depressive episodes. D. If the child doesn't have psychosis. The correct answer is C. If the child has recurrent depressive episodes. 74. All of the following are nursing interventions that may be appropriate for a child with depression, except A. Find ways to sustain the child's typical routine. B. Help him learn to cope with impulses. C. Monitor him for dangerous behavior. D. Provide appropriate times to eat. The correct answer is B. Help him learn to cope with impulses. 75. Blank is a neurobehavioral disorder characterized by sudden involuntary muscle movements and vocalization. A. Hallucination. B. Tourette syndrome. C. Down syndrome. D. Attention deficit hyperactivity disorder. The correct answer is B. Tourette syndrome. 76. Motor tics tend to affect which parts of the body? A. Head. B. Kidney. C. Lungs. D. Ears. The correct answer is A. Head. 77. Tourette syndrome usually appear before the age of blank. A. 18. B. 19. C. 20. D. 21. The correct answer is A. 18. 78. Tourette syndrome usually becomes apparent between ages blank and blank. A. 1 to 14. B. 2 to 15. C. 3 to 16. D. 4 to 17. The correct answer is B. 2 to 15. 79. Roughly one-half of the Tourette syndrome patients experience symptoms by age blank. A. 5. B. 6. C. 7. D. 8. The correct answer is C. 7. 80. Many people with Tourette syndrome have which of the following associated behavioral problems? A. Obsession and compulsion. B. Inattention. C. Hyperactivity. D. All of the above. The correct answer is D. All of the above. 81. Which of the following is typically the first sign of Tourette syndrome? A. Eye blinking. D. Body bending. C. Foot stamping. D. All of the above. The correct answer is A. Eye blinking. 82. Which of the following tends to worsen tics of a Tourette syndrome patient? A. Excitement. B. Obsessive thinking. C. Coprolalia. D. All of the above. The correct answer is A. Excitement. 83. Which of the following is a sign of Tourette syndrome? A. Compulsive behavior. B. Boredom. C. Tiredness. D. Stress. The correct answer is A. Compulsive behavior. 84. Before a patient can be diagnosed with Tourette syndrome, tics must be present for at least A. 6 months, B. 8 months, C. 10 months, D. 12 months. The correct answer is D. 12 months. 85. The purpose of psychotherapy in the treatment of Tourette syndrome is to help the patient and family learn about blank. A. The nature of the disorder. B. How to manage symptoms. C. Stress management strategies. D. All of the above. The correct answer is D. All of the above. 86. Specific drug therapy in the treatment of Tourette syndrome may involve which of the following drugs? A. Prozac. B. Zoloft. C. Haloperidol. D. Paroxetine. The correct answer is C. Haloperidol. 87. Which of the following nursing interventions may be appropriate for a child with Tourette syndrome? A. Promote the child's self-esteem. B. Monitor him for dangerous activities. C. Identify abusive communication. D. All of the above. The correct answer is A. Promote the child's self-esteem. 88. Blank is characterized by inappropriate responses to the environment and pronounced impairments in language. A. Tourette syndrome. B. Autistic disorder. C. Mental retardation. D. Conduct disorder. The correct answer is B. Autistic disorder. 89. All of the following about autistic disorder is true except A. An autistic child lacks interest in social interactions. B. Autistic disorder occurs in 7 to 8 of every 10,000 children. C. It is more common in boys than girls. D. It begins in childhood and lasts throughout life. The correct answer is B. Autistic disorder occurs in 7 to 8 of every 10,000 children. 90. Which of the following are signs of autism? A. Hand flapping. B. Insistence on sameness. C. No fear of danger. D. All of the above. The correct answer is D. All of the above. 91. Usually, autistic disorder is diagnosed by age blank. A. 2, B. 3, C. 4, D. 5. The correct answer is B. 3. 92. All of the following are screening tools for autism except A. Checklist for autism in toddlers. B. Autism Screening Questionnaire. C. Adult Autism Scale. D. Screening Test for Autism in 2-year-olds. The correct answer is C. Adult Autism Scale. 93. Autism is diagnosed based on clear evidence of which of the following? A. Poor or limited social relationships. B. Underdeveloped communication skills. C. Repetitive behaviors. D. All of the above. The correct answer is D, all of the above. 94. Blank refers to below average general intellectual functioning with associated deficit in communication, social skills, self-care, and adaptive behavior. A. Mental retardation. B. Autism. C. Conduct disorder. D. Tourette syndrome. The correct answer is A. Mental retardation. 95. A child with mental retardation has IQ below blank. A. 100. B. 90. C. 80. D. 70. The correct answer is D. 70. 96. Moderate retardation is found between blank. A. IQ 20 to 34. B. IQ 35 to 49. C. IQ 50 to 70. D. IQ 81 to 100. The correct answer is B. IQ 35 to 49. 97. Which of the following are major signs of mental retardation? A. Neurologic impairments. B. Destroys property. C. Drug and alcohol use. D. Inquisitive behavior. The correct answer is A. Neurologic impairments. 98. Which of the following tests are used to measure social maturity and adaptive skills? A. Standardized IQ test. B. Development screening test. C. Bailey scale of infant development. D. Vine behavioral scales. The correct answer is D. Vine behavioral scales. 99. Which of the following is part of the key components of treating mental retardation? A. Behavior management. B. Environmental supervision. C. Family therapy to help parents develop coping skills. D. All of the above. The correct answer is D. All of the above. 100. When treating a patient with mental retardation, which of the following is very important? A. Teach the child adaptive skills like eating, dressing, and toileting. B. Assign different tasks to the child. C. Improving her self-esteem. D. Provide physical outlets for aggression release. The correct answer is A. Teach the child adaptive skills like eating, dressing, and toileting. Section 3. Disorders of the elderly. 1. A vast majority of Americans survive to at least age blank. A. 45. B. 50. C. 55. D. 65. The correct answer is D. 65. 2. All of the following are psychiatric disorders common among older adults except A. Anxiety. B. Attention deficit hyperactivity disorder. C. Depression. D. Dementia. The correct answer is B. Attention deficit hyperactivity disorder. 3. Which of the following is a barrier to treatment of psychiatric disorders among adults? A. Many people believe that depression is part of the natural conditions of aging. B. Many adults are reluctant to discuss psychological symptoms. C. Treatment of mental disorder in older adults can be complex. D. All of the above. The correct answer is D. All of the above. 4. Almost one in blank persons age 85 or older experiences severe symptoms of depression. A, 4, B, 5, C, 6, D, 7. The correct answer is A, 4. 5. Older adults have the blank suicide rate in the United States. A, highest. B, second highest. 3, third highest. D, fourth highest. The correct answer is A, highest. 6. Blank addresses the unique mental health care needs of elderly patients. A, gerontologic nursing. B, geropsychiatric nursing. C, medical surgical nursing. D, community health nursing. The correct answer is B, geropsychiatric nursing. 7. Which of the following can work as a typical case manager? A, geropsychiatric nurse. B, pathophysiological nurse. C, psychopharmacological nurse. D, all of the above. The correct answer is A, geropsychiatric nurse. 8. The geropsychiatric nurse must have thorough knowledge of which of the following? A, pathophysiology. B, psychopharmacology. D, normal aging process. D, all of the above. The correct answer is D, all of the above. 9. Blank APNs combine strong background in medical surgical nursing and psychiatric nursing with patient education. A, geriatric. B, geropsychiatric. C, geropsychologist. D, all of the above. The correct answer is B, geropsychiatric. 10. APNs may be more capable than other healthcare professionals in meeting the needs of older adults because blank. A, they are more friendly. B, they are more qualified. C, they are more accessible. D, all of the above. The correct answer is C, they are more accessible. 11. Blank provides behavioral health care for elderly adults with mental disorders. A, geropsychologist. B, geropsychiatrist. C, geriatric APN. D, community health nurse. The correct answer is A, geropsychologist. 12. Blank are medical doctors with advanced training in assessing and treating mental disorders and related medical problems in older adults. A, geropsychologist. B, geropsychiatrist. C, geriatric APN. D, community health nurse. The correct answer is B, geropsychiatrist. 11. The geropsychiatrist is expected to have knowledge of blank. A, psychopharmacology. B, biological determinants of mental impairment. C, age and gender-related changes in physiology. D, all of the above. The correct answer is D, all of the above. 14. Normal aging brings which of the following changes in mental functioning? A, decline in intelligence. B, decline in learning ability. C, decline in reaction time. D, all of the above. The correct answer is D, all of the above. 15. The decline in mental functioning becomes more significant by about age blank. A, 65, B, 75, C, 85, D, 90. The correct answer is B, 75. 16. Which of the following changes occur in the brain with age? A, 20% decrease in the brain's weight by age 90. B, selective loss of 10% of neurons. C, 30% decline in synapse. D, all of the above. The correct answer is A, 20% decrease in the brain's weight by age 90. 17. Which of the following is true about the aging brain? A, intellectual functioning remains stable. B, many older adults remain inflexible in behavior. C, many older adults remain inflexible in attitude. D, all of the above. The correct answer is A, intellectual functioning remains stable. 18. Which of the following is true about cognitive changes in older adults? A, older brains are more organized. B, older adults use less of their brains. C, cognitive capacity declines. D, all of the above. The correct answer is C, cognitive capacity declines. 19. Which of the following is true about memory and manipulation? A, mental processing grows more efficient with age. B, world knowledge gained through experiences remain intact. C, accumulated world knowledge decreases. D, none of the above. The correct answer is B, world knowledge gained through experiences remain intact. 20. Which of the following is a possible cause of cognitive disorder? A, disease. B, the brain's response to a systematic disturbance. C, reaction to toxic substance. D, all of the above. The correct answer is D, all of the above. 21. Blank manifests clinically as mental deficits in patients who previously didn't show such deficits. A, cognitive disorders. B, cognitive functioning. C, cognitive relapse. D, cognitive reformation. The correct answer is A, cognitive disorders. 22. Blank is a prominent feature of many mental and physical disorders seen in adults. A, cognitive functioning. B, cognitive relapse. C, cognitive deficit. D, cognitive reformation. The correct answer is C, cognitive deficit. 23. All of the following are ways to aid memory retention, except A, giving full and total detail. B, using pictures. C, choose text that explicitly represents material. D, avoid instructions that require more mental processing. The correct answer is A, giving full and total detail. 24. A person's vocabulary increases slightly until about age blank and then starts to decline. A, 90. B, 80. C, 85. D, 75. The correct answer is D, 75. 25. Blank is the ability to solve novel problems. A, cognitive reformation. B, fluid intelligence. C. Mental processing capacity. D. Cognitive deficit. The correct answer is B. Fluid intelligence. 26. Blank is the ability to understand text, make inferences, and pay attention. A. Fluid intelligence. B. Cognitive reformation. C. Mental processing capacity. D. None of the above. The correct answer is C. Mental processing capacity. 27. All of the following decreases with age except A. Fluid intelligence. B. Mental processing capacity. C. Brain's weight. D. Intellectual functioning. The correct answer is D. Intellectual functioning. 28. All of the following are cognitive process minimally affected by aging, except A. Working memory. B. Implicit memory. C. Prospective memory. D. Picture recognition. The correct answer is A. Working memory. 29. Blank is used for tasks such as keeping a phone number in mind just long enough to write it down. A. Implicit memory. B. Working memory. C. Prospective memory. D. None of the above. The correct answer is B. Working memory. 30. Blank is responsible for storing information on a relatively permanent basis. A. Working memory. B. Prospective memory. C. Long-term memory. D. Implicit memory. The correct answer is C. Long-term memory. 31. High cognitive performance in older adults depends on which of the following? A. Educational level. B. Activity level. C. Peak pulmonary flow rate. D. All of the above. The correct answer is D. All of the above. 32. Which of the following is an important risk factor for depression in older adults? A. Death of loved ones. B. Low self-esteem. C. Low social status. D. Fear. The correct answer is A. Death of loved ones. 33. Blank is the natural response to a loved one's death. A. Insomnia. B. Loss of appetite. C. Bereavement. D. Anxiety. The correct answer is C. Bereavement. 34. All of the following are red flags of bereavement, except A. Frequent thoughts of death. B. Constant fidgeting. C. Sense of worthlessness. D. All of the above. The correct answer is B. Constant fidgeting. 35. Blank refers to a sequence of mood changes that occurs in response to an actual or perceived loss. A. Mood swings. B. Bereavement. C. Grief. D. Depression. The correct answer is C. Grief. 36. Acute grief usually lasts up to blank. A. 1 week. B. 1 month. C. 1 year. D. 13 years. The correct answer is C. 1 year. 37. Which of the following is a stage of grieving? A. Disequilibrium. B. Reinvention. C. Relapse stage. D. Revive stage. The correct answer is A. Disequilibrium. 38. In the blank stage of grieving, the patient typically experiences loss of self-esteem. A. Relapse stage. B. Disequilibrium. C. Reorganization. D. Disorganization. The correct answer is D. Disorganization. 39. In the blank stage, the patient establishes new goals and interpersonal relationships. A. Revive. B. Reorganization. C. Equilibrium. D. None of the above. The correct answer is B. Reorganization. 40. Which of the following is a sign of pathologic grief reaction? A. Psychosomatic illness. B. Extreme hostility. C. Wooden or formal conduct. D. All of the above. The correct answer is D. All of the above. 41. All of the following are steps to help a patient cope with grief, except A. Establish a rapport and build trust. C. Encourage him to express sadness or anger. C. Help patients establish a regular daily routine. D. Help him determine what realistic changes he needs to make. The correct answer is C. Help patients establish a regular daily routine. 42. Which of the following is true about assessing and diagnosing depression in elderly patients? A. Diagnosing disorder in elderly patients are challenging. B. Older patients are likely to report psychological symptoms than any other symptom. C. Coexisting medical disorders are more common in younger than older patients. D. Mental disorders can be differentiated clearly from non-pathologic types of age-related cognitive decline. The correct answer is A. Diagnosing disorder in elderly patients are challenging. 43. Which of the following is not true about the treatment of psychiatric disorder in elderly people? A. Treatment may include support groups. B. Multidisciplinary team approach may be used. C. The team may include a dietitian. D. Referral should not be made early in the treatment process. The correct answer is D. Referral should not be made early in the treatment process. 44. Blank gives adults the chance to discuss how their illness affects their lives. A. Outpatient therapy. B. Support groups. C. Counseling. D. All of the above. The correct answer is B. Support groups. 45. In many hospitals, the work of the blank is to aid rapid expert assessment and interventions. A. Nurse. B. Social worker. C. Liaison psychiatric intervention. D. Psychiatrist. The correct answer is C. Liaison psychiatric intervention. 46. Blank elderly patients are at much greater risk for falls. A. Agitated. B. Depressed. C. Relaxed. D. All of the above. The correct answer is A. Agitated. 47. When providing care in a patient's home, you'll need to be thoroughly familiar with which of the following? A. Physical assessment techniques. B. Crisis de-escalation. C. Community service. D. All of the above. The correct answer is D. All of the above. 48. Which of the following is not a requirement of OBRA, Omnibus Budget Reconciliation Act? A. Mandates the monitoring of physical restraints in skilled nursing facilities. B. Mandates the monitoring of chemical restraints in skilled nursing facilities. C. New residents may be screened depending on mental situations before admission. D. Skilled nursing facilities should have professional mental health consultants. The correct answer is C. New residents may be screened depending on mental situations before admission. 49. A geriatric patient with a history of acting out behavior needs a thorough physical assessment with baseline diagnostic tests, including which of the following? A. Electrocardiography. B. Complete blood count with differential. C. Chemistry panel. D. All of the above. The correct answer is D. All of the above. 50. Intervention should aim to provide all of the following, except A. Keep the patient from harming himself or others. B. Provide rapid sedation. C. Teach him appropriate ways of behaving. D. Avoid over-medication. The correct answer is C. Teach him appropriate ways of behaving. 51. Blank are used to evaluate patients for suspected dementia and to stabilize aggressive patients. A. Inpatient geropsychiatric units. B. Hospital emergency departments. C. Long-term care facilities. D. None of the above. The correct answer is A. Inpatient geropsychiatric units. 52. Blank provides intense, structured, multidisciplinary therapy for patients who have more acute needs than outpatients. A. Hospital emergency departments. B. Long-term care facilities. C. Partial hospitalization. D. Inpatient geropsychiatric units. The correct answer is C. Partial hospitalization. 53. In a partial hospitalization program, nursing care focuses on which of the following? A. Stabilizing lifestyle changes to help the patient stay well. B. Preparing the patient and his family to adapt to living with mental illness. C. Teach patients how to manage stress. D. All of the above. The correct answer is D. All of the above. 54. Blank is a practice whereby older adults take concurrent multiple medication for coexisting illness. A. Drug therapy. B. Polypharmacy. C. Outpatient therapy. D. Medication therapy. The correct answer is B. Polypharmacy. 55. Blank causes involuntary jerky movements of the face, tongue, and jaws. A. Motor disorder. B. Involuntary movement disorder. C. Medical disorder. D. All of the above. The correct answer is A. Motor disorder. 56. Generally, dosages for older adults should start at blank of the amounts used by younger adults. A. 10%. B. 15%. C. 20%. D. 25%. The correct answer is D. 25%. 57. Which of the following is a challenge to drug compliance by elderly patients? A. A large number of doses. B. Poor doctor-to-patient relationship. C. Misreading instructions. D, all of the above. The correct answer is D, all of the above. 58. There are blank prerequisites for diagnosing tardive dyskinesia. A2, B3, C4, D5. The correct answer is B3. 59. St. John's wort is known for treating which of the following? A. Depression, B. Anxiety, C. Schizophrenia, D. Tourette syndrome. The correct answer is A. Depression. 60. Which of the following is true about St. John's wort? A. Can be obtained without prescription. B. It's available as a tea. C. It's available as oil extract. D. All of the above. The correct answer is D. All of the above. 61. Which of the following is not true about administering psychotropic drugs to elderly patients? A. Psychotropic drugs may cause over-sedation. B. All patients respond to psychotropic drugs immediately. C. Drug accumulation may occur through caregivers. D. Drugs take longer to excrete. The correct answer is B. All patients respond to psychotropic drugs immediately. 62. Blank is the process used to detect toxicity in the blood or urine. A. Toxicity scaling. B. Toxicology screening. B. Toxicity identification system. D. Toxic condensed scaling. The correct answer is B. Toxicology screening. 63. Blank refers to an objectively identified decrease in cognitive functioning related to aging that's within normal limits and not attributable to a specific mental disorder. A. Age-related cognitive decline. B. Natural age cognitive decline. C. Expected age cognitive decline. D. None of the above. The correct answer is A. Age-related cognitive decline. 64. ARCD, age-related cognitive decline, is characterized by which of the following? A. Deterioration in memory. B. Deterioration in concentration. C. Deterioration in language use. D. All of the above. The correct answer is D. All of the above. 65. All of the following are signs and symptoms of ARCD, age-related cognitive decline, except A. Inappropriate dressing. B. Aggressiveness. C. Weight loss. D. All of the above. The correct answer is B. Aggressiveness. 66. Which of the following are risk factors for ARCD, age-related cognitive decline? A. Female gender. B. History of myocardial infarction. C. Heart failure. D. All of the above. The correct answer is D. All of the above. 67. The diagnosis of ARCD, age-related cognitive decline, should only be considered when which of the following has been eliminated as the cause of cognitive impairment? A. Mental disorders. B. Physical disabilities. C. Abnormal movements. D. All of the above. The correct answer is A. Mental disorders. 68. Blank is marked by global progressive impairment of cognitive functioning and personality. A. Age-related cognitive decline. B. Depression. C. Alzheimer's type dementia. D. None of the above. The correct answer is C. Alzheimer's type dementia. 69. Which of the following is true about dementia? A. Dementia is reversible if diagnosed early. B. Vascular dementia isn't as serious a health problem as Alzheimer's disease. C. Dementia causes rapid loss of language skills. D. As dementia progresses, most patients find it difficult to express themselves. The correct answer is D. As dementia progresses, most patients find it difficult to express themselves. 70. Blank are the damaged remains of microtubules. A. Neurofibrillary tangles. B. Beta amyloid. C. Apolipoprotein E. D. Aphasia. The correct answer is A. Neurofibrillary tangles. 71. Beta amyloid accumulates and forms sticky patches called blank. A. Nerve cell fibers. B. Tau protein. C. Neuritic plaques. D. Neurofibrillary tangle. The correct answer is C. Neuritic plaques. 72. Blank is a support structure that permits nutrients to flow through neurons. A. Nerve cell fibers. B. Microtubules. C. Neurofibrillary tangle. D. Neuritic plaques. The correct answer is B. Microtubules. 73. Blank is a plasma protein involved in cholesterol transport. A. Apolipoprotein E. B. Tau protein. C. Beta amyloid. D. None of the above. The correct answer is A. Apolipoprotein E. 74. Which of the following is true about oxidation? A. Lack of oxidation triggers the activity of immune factors to repair injuries. B. When oxidants are underproduced, they can cause damage to cells and tissues. C. It plays a part in coronary disease and cancer. D. All of the above. The correct answer is C. It plays a part in coronary disease and cancer. 75. Signs and symptoms of Alzheimer's disease occur in blank stages. A2, B3, C4, D5. The correct answer is B3. 76. Which of the following relates to symptoms in stage 1 of Alzheimer's disease? A. Bowel and bladder incontinence. B. Continuous repetitive behaviors. C. Sleep disturbances. D. Tantrums. The correct answer is C. Sleep disturbances. 77. Which of the following relates to stage 2 of Alzheimer's disease? A. Socially unacceptable behaviors. B. Depression. C. Deterioration in personal appearance. D. All of the above. The correct answer is A. Socially unacceptable behaviors. 78. Impaired ability to perform motor activities despite intact motor function is known as blank. A. Agnosia. B. Aphasia. C. Apraxia. D. None of the above. The correct answer is C. Apraxia. 79. Which of the following is not true about Alzheimer's disease treatment? A. There are different cures for Alzheimer's disease. B. Drugs can be used to treat Alzheimer's disease. C. Antipsychotic agents such as haloperidol and risperidol can be used as drug therapy. D. Memory training may aid patients during certain stages of Alzheimer's disease. The correct answer is A. There are different cures for Alzheimer's disease. 80. Blank is also called vascular dementia. A. Alzheimer's disease. B. Multi-infarct dementia. C. Hyperabic dementia. D. None of the above. The correct answer is B. Multi-infarct dementia. 81. Which of the following is true about vascular dementia? A. Vascular dementia typically starts between age 60 and 75. B. It accounts for an estimated 10 to 20% of dementias. C. It affects more men than women. D. All of the above. The correct answer is D. All of the above. 82. All of the following are true about vascular dementia except A. The conditions tend to progress in stages. B. A sign of vascular dementia is depression. C. Diabetes is a contributing factor of vascular dementia. D. Approximately 50% of patients have both vascular dementia and Alzheimer's disease. The correct answer is D. Approximately 50% of patients have both vascular dementia and Alzheimer's disease. Section 4. Schizophrenic disorders. 1. Which of the following is a sign of schizophrenia? A. Withdrawal from reality. B. Illogical thinking. C. Delusions. D. All of the above. The correct answer is D. All of the above. 2. Which of the following is true about schizophrenia? A. Patients may have intellectual disturbances. B. Schizophrenics can distinguish reality from fantasy. C. Schizophrenics do not experience hallucinations. D. All of the above. The correct answer is A. Patients may have intellectual disturbances. 3. Schizophrenia occurs in blank subtypes: A4, B5, C6, D7. The correct answer is B5. 4. Which of the following is a subtype of schizophrenia? A. Catatonic. B. Paranoid. C. Disorganized. D. All of the above. The correct answer is D. All of the above. 5. Which of the following is true about schizophrenia? A. A patient subtype may change over time. B. The most common shift is from paranoid to disorganized. C. Undifferentiated is a subtype of schizophrenia. D. All of the above. The correct answer is D. All of the above. 6. Approximately blank in every 100 persons develop schizophrenia during their lifetime. A1, B2, C3, D4. The correct answer is A1. 7. Schizophrenia is more prevalent than which of the following diseases? A. Alzheimer's disease. B. Diabetes. C. Multiple sclerosis. D. All of the above. The correct answer is D. All of the above. 8. Schizophrenics account for about blank of all Social Security disability days. A. 10%. B. 20%. C. 30%. D. 40%. The correct answer is B. 20%. 9. Approximately blank of schizophrenics commit suicide. A. 2%. B. 4%. C. 8%. D. 10%. The correct answer is D. 10%. 10. All of the following are true about schizophrenia except A. Usually symptoms emerge over just a few days or a week. B. The most common age at disease onset is late adolescence. C. In females, the disease typically starts in the 20s. D. In males, the disease typically starts in the late teens. The correct answer is A. Usually symptoms emerge over just a few days or a week. 11. Which of the following is not true about schizophrenia? A. Schizophrenics are more violent than other people. B. Many schizophrenics neglect their personal hygiene. C. Their life expectancy is about 10 years shorter. D. Schizophrenics often end up unemployable. The correct answer is A. Schizophrenics are more violent than other people. 12. Which of the following is a factor linked to a poor prognosis? A. Late or sudden disease onset. B. Early age at onset. C. Minimal cognitive impairment. D. Relatively good pre-illness functioning. The correct answer is B. Early age at onset. 13. Schizophrenia is more prevalent among blank socioeconomic groups. A. Higher. B. Middle. C. Lower. D. All of the above. The correct answer is C. Lower. 14. Schizophrenia is more common among blank. A. Married people. B. Single people. C. Gay people. D. None of the above. The correct answer is B. Single people. 15. About blank of schizophrenics are substance abusers. A. 20%. B. 30%. C. 40%. D. 50%. The correct answer is D. 50%. 16. Substance abuse may lead to which of the following? A. Frequent hospitalization. B. Declining function. C. Loss of social support. D. All of the above. The correct answer is D. All of the above. 17. Which of the following is true about schizophrenia? A. Persons who have a first-degree relative with the disease stand a 50% chance of developing it. B. Those at the highest risk are the children of two schizophrenic parents. C. Nearly half of diagnosed schizophrenics have no family history of the disease. D. All of the above. The correct answer is B. Those at the highest risk are the children of two schizophrenic parents. 18. According to the blank theory, schizophrenia results from an overactive dopamine system in the brain. A. Dopamine. B. Biochemical. C. Glutamate. D. Genetic. The correct answer is A. Dopamine. 19. Which of the following theory explains symptoms such as hallucinations and agitation? A. Dopamine. B. Biochemical. C. Glutamate. D. Genetic. The correct answer is A. Dopamine. 20. Blank believes that schizophrenia occurs when a biologically susceptible person experiences an environmental stressor. A. Stress theory. B. Biochemical theory. C. Vulnerability stress theory. D. Environmental stress theory. The correct answer is C. Vulnerability stress theory. 21. A recent study found that schizophrenics have an excess of blank in the frontal part of the cerebral cortex. A. Genetic predisposition. B. Dopamine 1 receptors. C. Viral infection in the central nervous system. D. All of the above. The correct answer is B. Dopamine 1 receptors. 22. Schizophrenia may involve abnormalities in which of the following? A. Endorphins. B. Norepinephrine. C. Serotonin. D. All of the above. The correct answer is D. All of the above. 23. Increased dopamine activity seems to correlate with blank. A. Paranoid symptoms. B. Schizophrenia symptoms. C. Depression. D. Hallucination. The correct answer is A. Paranoid symptoms. 24. Scientists using neuroimaging techniques have discovered which of the following in living schizophrenics? A. Enlarged ventricles. B. Reductions in the sizes of certain brain regions. C. Abnormalities in specific brain functions. D. All of the above. The correct answer is D. All of the above. 25. Blank suspects that schizophrenia results from faulty connections formed by neurons during fetal development. A. Psychologist. B. Pharmacologist. D. Developmental neurobiologist. D. All of the above. The correct answer is C. Developmental neurobiologist. 26. Which of the following are conditions linked to schizophrenia? A. Birth trauma. B. Head injury. C. Stroke. D. All of the above. The correct answer is D. All of the above. 27. Assessment findings on schizophrenia will depend on which of the following? A. Disease subtype. B. Prevailing symptoms type. C. Illness phase. D. All of the above. The correct answer is D. All of the above. 28. Which of the following is a speech abnormality? A. Echopraxia. B. Echolalia. C. Ambivalence. D. None of the above. The correct answer is B. Echolalia. 29. Involuntary repetition of movement observed in others is known as A. Neologism. B. Echopraxia. C. Echolalia. D. Delusion. The correct answer is B. Echopraxia. 30. Blank symptoms are deviant symptoms that are present but should be absent. A. Positive symptoms. B. Negative symptoms. C. Disorganized symptoms. D. All of the above. The correct answer is A. Positive symptoms. 31. The most common feature of schizophrenia is blank. A. Neologism. B. Hallucinations. C. Overly concrete thinking. D. Illogical word groupings. The correct answer is B. Hallucinations. 32. Blank may cause the patient to think that someone is reading his thoughts or monitoring him. A. Hallucinations. B. Magical thinking. C. Delusions. D. Thought blocking. The correct answer is C. Delusions. 33. Which of the following is true about schizophrenia? A. The agitated psychomotor behavior of some schizophrenic patients reflects excessive energy. B. A schizophrenic may experience either hallucinations or delusions, but not both. C. Schizophrenics don't have the ability to form abstract thoughts. D. Positive symptoms show that the patient is not yet psychotic and hasn't lost touch with reality. The correct answer is C. Schizophrenics don't have the ability to form abstract thoughts. 34. A patient with blank delusion thinks that passages in the newspapers are directed at him. A. Persecutory delusion. B. Reference delusion. C. Thought withdrawal. D. Thought insertion. The correct answer is B. Reference delusion. 35. In blank delusion, the patient believes that outside forces are imposing their thoughts or impulses on him. A. Thought withdrawal. B. Persecutory. C. Reference. D. None of the above. The correct answer is A. Thought withdrawal. 36. Blank symptoms reflects the absence of normal characteristics. A. Positive symptoms. B. Negative symptoms. C. Disorganized symptoms. D. Referral symptoms. The correct answer is B. Negative symptoms. 37. Blank refers to speech that is brief and lacks content. A. Blunted affect. B. Anhedonia. C. Poverty of speech. D. Apathy. The correct answer is C. Poverty of speech. 38. All of the following are examples of negative symptoms, except A. Apathy. B. Lack of motivation. C. Hallucination. D. Blunted affect. The correct answer is C. Hallucination. 39. Blank refers to confused thinking and speech. A. Thought insertion. B. Thought disorder. C. Asociality. D. Blunted affect. The correct answer is B. Thought disorder. 40. Disorganized symptoms include which of the following? A. Bizarre behavior. B. Negative symptoms. C. Thought withdrawal. D. Thought insertion. The correct answer is A. Bizarre behavior. 41. Schizophrenia usually progresses in blank distinct phases. A2, B3, C4, D5. The correct answer is B3. 42. During the blank stage, the person shows a clear decline from his previous level of functioning. A. Diagnostic stage. B. Residual stage. C. Prodromal stage. D. Active phase. The correct answer is C. Prodromal stage. 43. At what stage does the patient withdraw from friends, hobbies, and other interests? A. Diagnostic stage. B. Residual stage. C. Prodromal stage. D. Active stage. The correct answer is C. Prodromal stage. 44. At what stage does the patient experience acute psychotic symptoms? A. Diagnostic stage. B. Residual stage. C. Prodromal stage. D. Active phase. The correct answer is D. Active phase. 45. The patient with blank disease course is usually stable. A. Mild. B. Moderate. C. Severe. D. Acute. The correct answer is A. Mild. 46. The patient with blank disease course doesn't comply with his drug regimen. A. Moderate. B. Mild. C. Severe. D. Acute. The correct answer is C. Severe. 47. Which of the following is not true about a patient with a moderate disease course? A. He takes his prescribed drugs most of the time. B. He has frequent relapses and stable only for brief periods within relapses. C. He is not fully compliant with his drug regimen. D. He has several major relapses by age 45. The correct answer is B. He has frequent relapses and stable only for brief periods within relapses. 48. Which of the following is true about the diagnosis of schizophrenia? A. No diagnostic test definitely confirms schizophrenia. B. Patient should undergo physical and psychiatric examinations. C. The doctor may carry out a dexamethasone suppression. D. All of the above. The correct answer is D. All of the above. 49. Which of the following is an example of signs that must be present for a significant part of a 1-month period in order to meet the criteria for diagnosis of schizophrenia? A. Delusions. B. Catatonic behavior. C. Disorganized behavior. D. All of the above. The correct answer is D. All of the above. 50. Which of the following is the most effective method of treating schizophrenia? A. Drug therapy. B. Psychosocial therapy. C. Electroconvulsive therapy. D. Rehabilitation. The correct answer is A. Drug therapy. 51. Schizophrenics tend to develop symptoms on an average of blank before they are presented for treatment. A. 1 to 2 months. B. 3 to 6 months. C. 6 to 12 months. D. 12 to 24 months. The correct answer is D. 12 to 24 months. 52. There are blank categories of antipsychotics available. A2, B3, C4, D5. The correct answer is B3. 53. Blank antipsychotic have been used the longest. A. Conventional antipsychotic. B. Clozapine. C. Olanzapine. D. Quetiapine. The correct answer is A. Conventional antipsychotic. 54. Which of the following is an adverse effect of antipsychotic drugs? A. Dystonia. B. Tardive dyskinesia. C. Neuroleptic malignant syndrome. D. All of the above. The correct answer is D. All of the above. 55. Blank causes restlessness, pacing, and inability to sit still. A. Dystonia. B. Orthostatic. C. Akathisia. D. Tardive dyskinesia. The correct answer is C. Akathisia. 56. Blank refers to prolonged, repetitive muscle contractions that may cause twisting or jerking movements. A. Dystonia. B. Orthostatic. C. Akathisia. D. Tardive dyskinesia. The correct answer is A. Dystonia. 57. Introduced in 1990, blank was the first atypical antipsychotic. A. Olanzapine. B. Clozapine. C. Quetiapine. D. Risperidone. The correct answer is B. Clozapine. 58. Newer atypical antipsychotics offer all of the following except A. They cure negative symptoms. B. They improve neurocognitive deficits. C. They relieve positive symptoms. D. They're less likely to cause motor adverse effects. The correct answer is A. They cure negative symptoms. 59. Blank is a potentially fatal blood disorder marked by a low white blood cell count and pronounced neutrophil depletion. A. Neuroleptic malignant syndrome. B. Orthostatic hypotension. C. A granulocytosis. D. Akathisia. The correct answer is C. A granulocytosis. 60. Blank homes are intensive residential programs with on-site clinical staff who can provide 24-hour supervision and treatment. A. Transitional group homes. B. Foster homes. C. Supervised apartment. D. Crisis home. The correct answer is D. Crisis home. 61. Blank homes are structured programs that typically offer in-house daily training in living skills and 24-hour coverage by paraprofessionals. A. Transitional group homes. B. Crisis homes. C. Foster homes. D. Boarding homes. The correct answer is A. Transitional group homes. 62. During the long-term recovery and maintenance phase of the illness, blank types of rehabilitation programs may be used. A2, B3, C4, D5. The correct answer is B3. 63. Which of the following programs help patients improve their work skills? A. Vocational rehabilitation program. B. Psychiatric rehabilitation program. C. Psychosocial rehabilitation program. D. All of the above. The correct answer is C. Psychosocial rehabilitation program. 64. Which of the following is marked by a tendency to remain in a fixed stupor for long periods? A. Catatonic schizophrenia. B. Disorganized schizophrenia. C. Paranoid schizophrenia. D. None of the above. The correct answer is A. Catatonic schizophrenia. 65. Which of the following is a sign of catatonic schizophrenia? A. Positive symptoms. B. Echolalia. C. Hallucinations. D. Delusions. The correct answer is B. Echolalia. 66. Which of the following is true about the treatment of catatonic schizophrenia? A. Conventional antipsychotics should be used to improve symptoms. B. The role of atypical antipsychotics in treating catatonic schizophrenia requires further evaluation. C. Experts recommend that the use of ECT should be avoided and not be used at all. D. Negative symptoms should be treated with lorazepam. The correct answer is B. The role of atypical antipsychotics in treating catatonic schizophrenia requires further evaluation. 67. Which of the following is an appropriate nursing intervention that can be used for schizophrenia patients? A. Offer reality orientation. B. Stay alert for violent outburst. C. Follow orders with respect to nutrition. D. All of the above. The correct answer is D. All of the above. 68. Which of the following is not true about paranoid schizophrenia? A. It tends to be less severely disabled than other schizophrenia types. B. It is more responsive to treatment than other schizophrenia. C. They experience more catatonic behavior than other schizophrenics. D. All of the above. The correct answer is C. They experience more catatonic behavior than other schizophrenics. 69. Signs of paranoid schizophrenia includes all of the following except A. Unfocused anxiety, B. Anger, C. Auditory hallucinations, D. Incoherence. The correct answer is D. Incoherence. 70. Blank is marked by incoherent, disorganized speech and behaviors and inappropriate affect. A. Disorganized schizophrenia, B. Undifferentiated schizophrenia, C. Paranoid schizophrenia, D. Catatonic schizophrenia. The correct answer is A. Disorganized schizophrenia. 71. A blank patient's symptoms doesn't match any other subtype. A. Disorganized schizophrenia, B. Undifferentiated schizophrenia, C. Catatonic schizophrenia, D. Residual schizophrenia. The correct answer is B. Undifferentiated schizophrenia. 72. Blank is a muted form of the disease that stops short of recovery. A. Residual schizophrenia, B. Undifferentiated schizophrenia, C. Catatonic schizophrenia, D. Disorganized schizophrenia. The correct answer is A. Residual schizophrenia. Section 5. Mood disorders. 1. Blank refers to a pervading feeling. A. Mental disorder, B. Mood,